Imagine a world where a doctor doesn't have to rely on memory or outdated textbooks. Instead, they have access to an AI assistant that has read every published medical study, understands genetics, patient history, and clinical guidelines, and can suggest the best treatment plan within seconds. This isn't sci-fi, this is IBM Watson, and it's already reshaping how we detect diseases, personalize treatments, and even discover new drugs. In this video, you'll learn how IBM Watson is changing healthcare forever, and why countries like the United States, United Kingdom, Canada, Australia, and across Europe are adopting this technology faster than ever. If you're a healthcare professional, a tech enthusiast, or just curious about the future of medicine, this video is for you. Stay till the end because what you'll discover may just blow your mind. IBM Watson is an AI-powered cognitive computing platform developed by IBM. It combines machine learning, natural language processing, and data analytics to mimic human reasoning, only much faster and far more data-driven. It first gained fame by beating human champions on Jeopardy! But since then, it has entered more serious territory, saving lives in hospitals, labs, and clinics around the world. Watson can read and understand unstructured data, like research articles, clinical notes, and patient histories, and deliver insights no human brain could gather alone. Healthcare systems today are overloaded. Doctors face information fatigue with thousands of new studies published every month. Diagnostic errors still occur far too often, and patient needs are becoming more complex and personalized. IBM Watson solves this by acting as an AI co-pilot, a partner to doctors, helping them make faster, evidence-based decisions with higher accuracy. It's not about replacing medical professionals, it's about enhancing their capabilities with intelligent, real-time support. Cancer. It's one of the most complex and feared diseases across the world. Each case is unique, and treatment decisions are often a race against time. But here's the question: what if AI could help doctors find the best treatment faster, and with more confidence? That's where IBM Watson for Oncology steps in. Developed in collaboration with Memorial Sloan Kettering Cancer Center, one of the top cancer institutes in the world, Watson for Oncology is designed to support oncologists by providing evidence-based treatment recommendations for over 13 types of cancers, including breast cancer, lung cancer, colorectal cancer, prostate cancer, ovarian and cervical cancers. So how does it work? Watson ingests a patient's full medical history, lab results, imaging reports, clinical notes, and compares it with millions of pages of oncology research, clinical guidelines, trial data, and expert-curated treatment plans. Within seconds, Watson categorizes treatment options as recommended for consideration and also not recommended, with evidence backing each decision. This helps doctors validate their decisions, avoid oversight, and even discover novel or lesser-known treatments that might not be top of mind. In India, Watson was used to assist oncologists in over 1,000 breast cancer cases, and its treatment recommendations aligned with human experts 96% of the time. In Thailand and China, hospitals are using Watson to expand access to high-quality cancer care in remote areas, where experienced oncologists may not be available. It's not about replacing doctors, it's about amplifying their capabilities, making expert-level care more consistent, accessible, and precise across the globe. With Watson for Oncology, the future of cancer care is not just high-tech. It's more personalized, faster, and full of hope. Let's take it a step deeper, into your DNA. IBM Watson for Genomics is helping usher in the era of precision medicine, where treatment is not just based on symptoms, but on your unique genetic profile. It works like this. Watson analyzes a patient's genomic sequencing data, compares it with millions of scientific articles, gene databases, and clinical trials, and identifies genetic mutations linked to various diseases, especially cancers and rare disorders. Here's where it gets powerful. Watson doesn't stop at identifying the mutation. It also recommends drugs or treatment plans that specifically target that genetic abnormality. This means faster, more accurate treatment, tailored to that specific patient, not just the general disease. In one real-world case, Watson was able to help doctors in South Korea identify a rare mutation in a cancer patient that led to a completely new treatment path, and improved outcome. This is especially impactful in oncology, neurology, and rare genetic conditions, where early and precise identification can be the difference between life and death. And the best part? What takes human experts weeks to analyze, Watson does in minutes with remarkable accuracy. Now let's talk about the patient experience. How many times have you had to wait on hold to reschedule a doctor's appointment, or misunderstood post-discharge instructions? Enter IBM Watson Assistant for Healthcare, an intelligent conversational AI that hospitals can use to automate appointment booking and reminders, answer FAQs about medications and recovery plans, provide symptom checkers, and even guide patients to the nearest lab or specialist. But this isn't your basic chatbot. Watson understands context, intent, and emotion. It can converse like a real medical support agent, and it learns from interactions to improve over time. For healthcare providers, it's a game changer. It reduces call center burden, improves patient satisfaction, and cuts administrative costs dramatically. Major hospitals in the United States and UK, like Cleveland Clinic and NHS Partner Systems, have already integrated Watson Assistants to streamline services and empower patients with 24/7 access to health information, anytime, anywhere. This is healthcare in your pocket. Every year, thousands of people die, not because there wasn't a treatment available, but because they weren't matched to the right clinical trial in time. Clinical trial matching is complex. Eligibility criteria are strict, detailed, and often buried in paperwork. Doctors and patients simply can't keep track of the thousands of trials going on at any moment. That's where Watson for clinical trial matching comes in. It automatically analyzes patient records, lab results, and diagnosis history, scans vast global trial databases, matches patients with precise eligibility filters, and suggests trials that are relevant, accessible, and potentially life-saving. And all this is done in seconds, not weeks. Hospitals in the US, Canada, and Europe are using Watson to increase enrollment in trials, especially for rare diseases and late-stage cancers, and to reduce the cost and duration of new drug development. Pharma giants are leveraging this to bring treatments to market faster. For patients, it's a second chance. For science, it's a leap forward. Radiologists today face an overwhelming task, reading through hundreds of scans per day, identifying subtle signs of disease and ensuring no critical detail is missed. But what if they had an AI partner watching every image too, noticing patterns even the most experienced eyes might miss? IBM Watson is doing exactly that. By integrating with radiology systems, Watson analyzes X-rays, MRIs, Connecticut scans, and ultrasound images, highlights abnormal regions, compares them with historic patterns, and provides evidence-backed suggestions for further diagnosis or follow-up. It learns from thousands of previous cases, peer-reviewed imaging studies, and even specific hospital protocols to deliver accurate second opinions in real time. In Europe and the US, early pilot studies have shown that radiologists using Watson are able to reduce diagnostic errors, catch early-stage diseases like lung cancer, stroke, or brain tumors, and speed up reporting times significantly. Watson doesn't replace radiologists, it amplifies their expertise. Together they deliver faster, safer, and more accurate care. We're entering a new era, where AI doesn't just assist in surgery or research. It thinks, learns, and evolves alongside doctors to improve lives, reduce suffering, and extend human potential. IBM Watson is more than just software. It's a symbol of what healthcare can become when technology and humanity work together. So here's a question for you. Would you feel more confident in a diagnosis or treatment plan if it was backed by Watson's AI? Let us know in the comments below. We'd love to hear your perspective. If you found value in this video, be sure to like, subscribe, and hit the bell icon so you never miss the future of health, AI, and medicine. Thanks for watching. Stay informed, stay inspired.